Hello and welcome back to today's episode, guys. How have you been? I'm hoping you've been doing well. I'm also doing well, and I believe that you are still keeping safe. Well, still coronavirus is here. I believe that you are still wearing your face masks properly. Cover your mouth, cover your nose. I believe that you're still sanitizing. I believe that you're still washing your hands. And I believe that you're still maintaining a social distance of 1.5 meters, guys. That is the only way we can help prevent the spread of COVID-19. I'm glad that you're back here today, guys, and welcome to today's learning episode. Today, I want us to talk about a very, very, very common illness, and that is diabetes mellitus. I believe, guys, you've heard of it. If not in the family, it's in the neighboring. If it's not in the neighboring, it's with your friends. Diabetes nowadays, it's very, very common because it's a lifestyle illness. So I will start by defining what is diabetes. So diabetes mellitus is a disease in which the blood glucose levels are high above the expected level. Blood glucose levels are high above the expected levels. What is the expected level? For a normal person, somebody who doesn't have diabetes, your blood glucose levels should range between, it's a range, guys, it's a range between 3.5 to 11.1 millimoles per liter. That is the normal range of a person who doesn't have diabetes. And so, or someone whose blood glucose levels read anything above 11.1 millimoles, that is a person we say he has diabetes mellitus. Diabetes mellitus. Have you understood, guys? That is the definition of diabetes. Blood glucose levels that are above 11.1 millimoles per liter. What is blood glucose? What is blood glucose? Blood glucose is the end product of the food that we eat. Blood glucose is the end product of the food that we eat. So when you take a meal, when you eat a meal, it's broken down to glucose. Glucose is absorbed to the bloodstream, and this glucose is what is used as energy by our bodies. We eat a meal, it's broken down to glucose. Glucose is absorbed to the bloodstream, and here it is used by our body as a form of energy. We need energy, guys. For our brain to function, it needs energy. For you to work, you need energy. So our body is made up of cells, and these cells, the food of the cells is glucose. So basically we need glucose for our bodies to function normally. So I want to take, have you understood, guys? We said diabetes is blood glucose level that is above 11.1 millimoles per liter. What is blood glucose? Blood glucose is the end product of the food that we eat. What is blood glucose used for? Blood glucose is a source of energy to our bodies, and our bodies need energy for it to function normally. So I want us to learn about the types of diabetes. the diabetes, there are types of diabetes. We have type 1 diabetes. What is type 1 diabetes? First, before we learn about type 1 diabetes, I want us to talk about a gland in our body called the pancreas. I don't know if you remember, guys, from your biology. There's a gland in our body called the pancreas, and the function of the pancreas is to produce a hormone called insulin and glucagon. Insulin and glucagon. The function of insulin is to convert the blood glucose that is in the glucose that is in the blood to it transports it through the muscles and the cells. That is the function of insulin. When you take a meal, it's broken down to glucose. Glucose is absorbed to the bloodstream. So the function of insulin is to transport excess insulin in the blood to the muscles and to the cells to store it there, so that again when your blood glucose goes down, now there's a hormone called glucagon that converts the glucose that was the glucose that was stored to the bloodstream, so that you can use it. So in type 1 diabetes, you find that the immune system is meant to attack infections in our bodies. But in type 1 diabetes, you find that your immune system mistakenly, underline the word mistakenly, your immune system mistakenly attacks the pancreas and destroys those cells that produce insulin. Are we together, guys? In type 1 diabetes, the immune system mistakenly attacks the pancreas and destroys the cells that produce insulin. What is insulin? Insulin is a hormone that is used to convert excess glucose in the bloodstream to store it to the muscles and to the cells. So in type 1, when the immune system mistakenly attacks your pancreas and destroys the cells that produce insulin, then that means whenever you eat, whenever you take a meal, the glucose that is produced, yes, it's not able to be stored to the muscles and the cells, because now your body cannot be able to produce insulin. Are we together, guys? So in type 1 diabetes, the body does not produce insulin. It does not produce insulin. Why? Because your immune system mistakenly attacks and destroys the cells that produce insulin. So once your body is not producing insulin, then that means the excess glucose that is in the bloodstream is not able to be stored to the muscles. Type 2 diabetes, it's where, yes, your body can produce insulin, but then the pancreas produces insulin, but then the body does not detect the insulin that is produced. So if the body doesn't detect the insulin that is produced, then that means the glucose is not going to be stored to the muscles. It will remain in the bloodstream. The insulin that is the glucose that is produced once you eat is not able to be stored to the muscles, so it remains in the bloodstream, hence high blood glucose levels. We have Gestational diabetes. This develops in pregnant women. So you find that you've not been suffering from diabetes, but the moment you conceive, when you're pregnant, you develop high blood sugars. But mostly this gestational diabetes dissolves once someone gives birth. Are we together, guys? Are we together? Type 1 diabetes, type 2 diabetes, gestational diabetes. So who is most likely to get diabetes? Who is most likely to get diabetes? If you have a family history of diabetes, I mean, if you come from a family where your mom has diabetes, or your dad, or your granddad, or your grandmom, if there is a family history of someone with diabetes, then you are most likely you are at a risk of getting diabetes. If you are overweight, carrying an extra weight, especially at your belly, that is a risk of getting diabetes, because the extra fat on your belly makes your cells to be resistant to the effects of insulin. Okay, guys? If you are overweight, especially if you have a belly fat, you are at a risk of getting diabetes. Why? Because that fat makes your cells to be resistant to the effects of insulin. Are we together? Who is more likely to get diabetes? If you have a family history. If you are overweight, you are most likely to develop diabetes. What are the symptoms? What are the symptoms of diabetes mellitus? Number one, guys, there are 3 typical symptoms of diabetes. These ones, if you you develop them, rush to the hospital and see your doctor. Number one, increased hunger. Increased hunger. You've been eating 1 plate of ugali. Nowadays, you feel like you want to eat 3 plates. Increased hunger. Number 2, increased thirsty. You used to drinking 4 glasses of water. Nowadays, you want to drink 16 glasses of water in a day. Increased thirsty. Number 3, increased urination. The more you drink a lot of water, the more you want to urinate. Increased thirsty. Rush to the hospital and see